Root canals are really bad words, two words to patients. They associated with excruciating pain. Everyone has heard a horror story about a root canal that's gone bad. And in my experience, root canals are very good procedures in order for us to save teeth. Ultimately, the best teeth that you can have are the ones that grew in your mouth, not the ones that dentists placed there for you. So we do everything we can in order to save the tooth, and very often if a tooth was traumatized, either from multiple fillings or a large cavity or trauma to the tooth where the nerve dies inside the tooth, we're able to go and clean out the dead nerve tissue, seal the tooth, and return the tooth back to normal function. Basically, all we do is make a small little hole, either in the top or the back of the tooth, depending on where the tooth is located. Remove the nerve fillet, put a filling in sometimes. If it's a very small hole we have to make, if the hole's big and the tooth is broken down, very often after root canal we have to put a crown on there too, just to support the tooth. It's not that the tooth becomes brittle over time, but it's kind of like hollowing out a stump of a tree. If the hole is too big in the middle of the stump, the sides are weak. And so that's why we typically recommend for patients to get crowns after root canals, because we've removed the coarse strands of the tooth. I've seen it happen often in my practice where patients delay getting the crown done after the root canal and the tooth fractures. And then they lose the investment in the root canal and the tooth has to be extracted. So it's very important after root canal to get a restoration place that will support the rest of the tooth.